And so I'm going to jump right in here. This was a question that I promised somebody that I would get to because it came in earlier last week. They said, my son has been glancing upwards and winking one eye while he has been sick with the flu. He does this intermittently. Is this common or a symptom of something else? If we need to evaluate, which kind of doctor should we go see? A neurologist? And thank you for your show.
Okay. Important question. And I don't know if he ever had winking before the flu, and now it's come back, or if this is the first time, but it's good the mother's paying attention to it. And certainly if it's associated with eye pain, I'd have him seen right away, maybe starting with his pediatrician, if there is pain involved. If it's just winking and looking up and not pain, but it continues even after the flu is gone, I would say that I would need further evaluation. I don't think it's common. I think this is a little bit of an unusual history. Now, kids can suddenly develop tics for no apparent reason, and a tic is a neurological symptom. It's an involuntary movement. So the looking up and winking one eye could possibly be a tic. And tics are fairly common in kids and might start to happen when there's an illness. They can kind of come and go or wax and wane. Maybe as he recovers from the flu and he's better, it'll just go away, and then all is fine. But if it still keeps coming back, a neurologist is actually a good place to start if it might be a tic. If there starts to be any swelling or involvement of the eyelid or vision concerns or whatnot, another possible doctor that the pediatrician might refer to is an ophthalmologist, an eye physician doctor. But I think starting with the pediatrician, and then my next step might be a neurologist. And between the pediatrician and neurologist, they could decide if they need an ophthalmologist involved. So hopefully it will resolve itself.
Okay, great. I'm going to move on to our next question, which is a very interesting question. For Dr. Copeland, does excessive bubbles in urine indicate anything? My 14-year-old son tends to wait a while before going to the bathroom. His pediatrician doesn't think it's an issue and I would like to have your input. Are there any tests you would recommend? And thank you. Bubbles in the urine.
Yeah, and it kind of depends on where the bubbles occur. So, and then how difficult the hesitation is before he urinates. I think it's pretty common that for some boys, they just have to focus a moment before they get their urine stream started. But if it's uncomfortable, if it's difficult to get the urine stream started, and he's feeling some discomfort with it, and there's these extra bubbles in the urine, if he's having burning in urination, then as you know, I like to involve the primary care doctor, the pediatrician, as much as possible. And so, oh, hold on just a minute. I'm getting some things. I'm blocking my screen. So just a basic test, if the pediatrician hasn't done it already, and it's an inexpensive test. A lot of doctors' offices can do it right there in their back office, and it's just a urine dipstick urinalysis to see if there's any abnormalities, any crystals, any white blood cells, any red blood cells, that sort of thing. And something the family could do at home would be if they had a little urine cup and if he captured a small amount of urine in the cup and let it dry out, if there were a lot of crystals, that sometimes that could be oxalate crystals or calcium carbonate crystals. That might be a little clue that there could be something going on that needs further workup. And then a rare thing, and there's no good reason for a 14-year-old to have it, but if the bubbles are coming, like he's getting air in his urine coming from the urethra, like at the tip of his urethra, the tip of his penis, and there's air mixed in with the urine, that is abnormal, and that should be followed up on. There should not be air bubbles directly in the urine coming out directly from the body. So it's one thing if there's a lot of bubbles in the toilet, the pediatrician may be right. It may not mean anything. Could mean there's some crystals issues. So you want to see if there's some high oxalate foods in the diet that might be causing that. But if there's air mixed in with the urine right as it's coming out, and it's kind of hard to urinate, you can get what's called a fistula, which is an abnormal connection between the intestines and the bladder and the urethra for some reason. And the air would actually be coming from the intestines. And that would make a kind of air bubbles right as the urine emerges. That's, again, rare. We don't see that often in children, but something to think about.
Okay. So, Dr. Copeland, our next question is, I'm wondering if you've talked about GI issues with children with autism. And they said, my son is 8 years old, nonverbal, and has GERD as well also. You could start by telling our other viewers what GERD is.
Oh, okay. GERD is gastroesophageal reflux disease. And it's pretty common. It seems to be increasing in all people, and it's pretty common in autism. So it's basically acid reflux, digestive acid reflux, which can cause heartburn symptoms or kind of painful swallowing, you may feel it as a bubble coming up from your stomach. It can present in a number of different ways. And it seems to be pretty common in autism spectrum disorders as well as the general population. So it's something that pediatric gastroenterologists treat. Mild GERD, the primary care physician, whether it be a pediatrician or family practitioner, may treat it as well. So it's usually treated with antacid medicines. And of course, the GI issues are huge in autism spectrum disorder, and they can be very ranging and variable. So to the extent that we can look at diet to see if that might help, and there's a variety of diets. You can go with low yeast diets, the gluten-free, casein-free, soy-free may be a good place to start. But some children need more. Some specific foods may be irritating them. One thing that can cause pain, GI pain, is too many oxalates in the diet. So sometimes you want to see if they have a craving for certain foods that are really high in oxalates. A lot of those foods are often healthy foods, but if they're eating too many of the high oxalate foods, it can aggravate their symptoms. So like beets, carrots, and celery, hey, they're good vegetables, but if they're eating too much of those combined with citrus, plus pomegranate, plus raspberries, plus almonds. Almonds are probably the nuts that are highest in oxalate. Well, we think of all of those as being healthy foods. If that's like some of their favorites and they're eating them every day, that might be a further aggravating factor. So consulting with a nutritionist might help to see if that could help manage the GERD in addition to taking antacid medication. And then the other thing is elevating the head of the bed so they're not sleeping so flat. Might be some ideas to address those issues.
And then in terms of, in general, for gastrointestinal issues, this is a very hot topic right now with autism.
Oh, yeah. A lot of research going on with it.
And it seems like for a lot of...
Well, I tried my attempt to keep movement going here, and my lights went out. Let me get the lights
We
out.
love that Dr. Copeland is so environmentally conscious that she has her office lights on a timer so that if no one is in there, it will automatically turn off. And you see her little air streamer in the back. She's got her green streamers. This I thought it was ingenious that this was that we were hoping that was enough movement so that it wouldn't go off. But I think it's a great reminder of how environmentally conscious you are. So I applaud that.
I'll have to do my exercises.
There you go. When we take a break, we'll have you do jumping jacks.
Right.
But in any case, we were talking about GI issues that we see that a lot of kids on the autism spectrum have issues with their gastrointestinal system. It's not unusual, and there's more and more studies that are being done on this.
Yes. Yeah. And some of it may be genetically based and some might be environmentally based. We know there can be issues of yeast overgrowth. There can be issues of small intestinal bacterial overgrowth, or what we call SIBO. And symptoms you'll get a lot of gas, a lot of bloating. You may get alternating constipation and diarrhea. And that's where paying close attention to the diet can be really helpful, and trying to get on one of the healing diets. Children with autism spectrum disorder, especially when they're very young, and I'm going to be moving around here, may be very picky eaters and may kind of crave the carbohydrates and just eat a very limited number of carbohydrate foods, and that will kind of contribute to these problems of yeast overgrowth or small intestinal bacterial overgrowth, because the unfriendly bacteria and the yeast feed on all those carbohydrates. So we really need to get a healing diet that's nutrient dense, with a good source of protein from lean organic meats, grass-fed meats, good sources of healthy cold-pressed oils, and gradually increasing the variety of healthy vegetables and fruits the child will take to kind of manage those challenging GI symptoms.
Great. And we're going to be hearing more about GI issues, because there's a lot of studies that are being done right now. A lot of people spending a lot of money on this subject, GI issues and autism. But this next question kind of goes hand in hand with this, Dr. Copeland. It says, Dear Shannon and Dr. Copeland, is it possible to have too much probiotic? We're battling yeast and want to increase as much as possible. What are the symptoms when it's too much? And thank you. Can we have too much probiotic?
Yes, potentially, and it depends. There's a whole variety of different kinds of probiotic, and this is not an exact science yet. But what we're looking for, you've got a sense that you've got the right level of probiotics. If your child is able to have a stool every day, if it's kind of a soft formed log, kind of medium brown in color, and regular, if you've been giving some probiotic and you kind of reach that and there's no more GI discomfort, the excessive gas and bloating have gone away, you're probably doing a pretty good job. But if you give too much probiotics, sometimes you can get an imbalance in even the good friendly bacteria might end up being where they're not supposed to be, too high up in the small intestine, and that's what we mean by a small intestine bacterial overgrowth, or SIBO. And then the symptoms would come back of the gas, bloating, abdominal discomfort, and then you might start with the alternation between the constipation and diarrhea. And also, depending on the probiotic, some children might not tolerate a certain brand. So you may have to, go with the good ones from Claire, other good brands, but you might have to try and explore several. And then you want to read the ingredients, and also think about doing natural fermentation if your child can tolerate that, and getting some probiotics that way. So naturally fermented homemade sauerkraut. The cabbage has a natural lactobacillus on it, and if you chop it up fine and ferment it in purified water and sea salt, you get a tremendous dose of probiotic, even more than in the commercially prepared probiotics, if your child can tolerate that. So you look at their response. If they immediately get diarrhea and a red bottom, you know it's too strong for them. And you're looking for a balance of lactobacillus, bifidobacteria, and you can eat, since you're battling yeast, one probiotic that's a bit unusual you could consider is an anti-yeast fungus that is a healthy probiotic. And I'll hold it up. I don't know if you can see that. is called Saccharomyces boulardii. I don't know if you can see the spelling of that. So it actually is a yeast itself, but it's a friendly yeast, and it's been studied in children. You can give it at a dose of 250 milligrams twice a day. So you might use yeast to battle yeast. The bad yeast is the candida. That's what you want to get rid of. So a little bit of the Saccharomyces boulardii may make it so that you don't have to do too much of the other probiotics. It's really, you kind of have to experiment with it and see how your child does the best, because it's so individual from person to person.
I have the Saccharomyces, I can't say it, the Saccharomyces boulardii, whatever it is, in my refrigerator. And I have bought it 2 times now. It's not inexpensive, I will say this. And I have been about to give it to my son, but then I always look at it and it says it's yeast. And I think, ooh, I'm trying to get the yeast out of him. And I've always chickened out. But it's a yeast to battle a yeast. So I could give it to him.
Right. It's like the firefighters who battle fire by making their own little fires to make it a firewall. It's that same idea. This is a friendly yeast that is anti-inflammatory. It also fights the toxins from bad bacteria. And it's been researched for over 50 years. A lot of studies, even in very young infants and children, as a helpful probiotic. So, you know, not every child is going to tolerate it, but they'll have it out of their system in a few days if you stop giving it. So it may be worth a try in your yeast battle.
Okay, and I want to go back to the fermenting things a little bit, because I think this is an area too where I've tried to make the sauerkraut on my kitchen counter. I need to take a class because I think it's a little bit more involved. But I do want to say that in my experience, I haven't been able to make it on my counter, but they do sell, if you go to health food stores, ones that have been fermented naturally, that haven't been heated to kill anything off. You can tell that it's one of the right ones by the price, often because they are infinitely more expensive. You can pay $8 for a little packet of sauerkraut, but even in the past, I've given my son a teaspoonful of it, and it's made a difference. And I also love Bubby's pickles, which are naturally fermented. There's no vinegar in them whatsoever. And the difference between if I give my son a Bubby's pickle, which has been naturally fermented, and he does better for a couple of days, whereas if I give him a regular pickle, that will leave a red bottom. So interesting.
Right. Oh, I'm so glad you mentioned that. And with me being a working physician, I don't have time to do my own fermentation. So it was a huge discovery for my husband and I when we discovered Bubby's. And so I shop at Nugget Market, and I think Trader Joe's and Whole Foods also carry Bubby's products.
And Sprouts
and they do have a natural sauerkraut as well that is delicious. And as you said, it's not heated. There's no vinegar in it. There's no sulfite or other bad ingredients. It's just cabbage, water, and salt. And it's totally delicious.
It is. It's good stuff. And it doesn't take a lot. I think a lot of us, when we think sauerkraut, and we picture, those giant hot dogs with this, a pile of sauerkraut or on a Reuben sandwich. But even a teaspoonful, I found, makes a difference for my son. And you can sprinkle it on something, the juice or, anything that you're making for them, and put it across the top, and it gives it a little zip. I think they quite like it.
Yes, it's good delicious.
And then if you get into I know people who are really into the fermentation. I just haven't been able to make it work. It's on my list of things to do, though.
Mine too.
Right. We'll take a class together, Dr. Copeland. I think it sounds really fun and save you a lot of money if you can do it on your own in a very good health fit. So, Dr. Copeland, our next question. Hi, guys. Love this show. This question is for Dr. Copeland. My 4.5-year-old son always complains when using the toilet to do his bowel movements. He says it's hot or itchy. The consistency is not rough or liquidy. He's not constipated, nor does he have diarrhea. He seems really uncomfortable while sitting on the toilet, plus fidgety. And his bowels are really big, long, and thank you so much. And I always say, usually I do a disclaimer before I read this kind of a thing, but this is, we keep it real, as I know a lot of you are moms and dads out there, but we sometimes you just got to talk about the poop.
Right.
With
and
no
I'm a
apologies.
physician, so I'll take it in professional stride.
Yes.
So this is a very interesting problem because she's not describing either constipation or diarrhea, and he seems to be having long caliber stool, but he seems uncomfortable or if in pain. And I had mentioned previously oxalates, and that is making me wonder if oxalates in his diet might be the problem. But I should also, there's always a differential diagnosis in medicine, and you want to make sure there's not just some explanation just locally right around his anal area, the perianal area, that might be contributing to the discomfort. So it's worth taking a look at his bottom when he's taking a bath. Are you helping him dry off after the bath and so forth, just to make sure there's no rawness, redness, that may be a sign that he's having irritation. Surprisingly, you can actually get strep bacteria as a strep infection in the perianal area, just like you get a strep throat. And it can make the skin very itchy and painful and uncomfortable. So it would obviously be painful to have a bowel movement there. So the clue to it is you would see a ring of redness that looks very sore and irritated, even raw. You might even see some little, what we call excoriations with blood spots, and strep can do that. Less commonly, and I don't want to worry parents, if the child is not itching the first thing early in the morning, even before they hit the bathroom, then you don't have to worry so much about pinworms. But pinworms are another thing that's pretty common in children. It doesn't mean the household's not clean. In fact, pinworms like to live in cleaner houses. And the telltale sign of that is early morning itching. They'll feel the itching really early as they wake up, and that may make them a little raw and uncomfortable. There's an easy slide test for pinworms that the pediatrician can do, and there's an easy treatment for it. It's a pill called Vermox, and you should just take one pill now and a week from now. But chances are it's not that, especially if he's not having early morning itching. So back to the oxalate issue, it might be worth consulting with a nutrition, because one thing that high oxalates in the diet will do is it can cause pain anywhere. And it's often kind of a burning nerve pain. It can cause burning with urination, but it can also cause this burning nerve pain with bowel movements as well. And I mentioned earlier some foods that are high in oxalates. So some vegetables would be beets, carrots, celery, field greens, spinach, sweet potatoes, Swiss chard. A lot of these vegetables we think of as healthy vegetables, but if he's eating tons of them, plus tons of fruit that are high in oxalates, like citrus and kiwi and pomegranate and raspberries or blackberries. And then maybe he likes nuts like almonds and peanuts. And then if you're trying to do gluten-free and you're doing things like amaranth, buckwheat, and quinoa, he may be getting higher oxalates than you realize, and that could be contributing to the pain. If you go to a nutritionist and the nutritionist suspects there are high oxalates in the diet, you don't want to abruptly decrease the oxalates all at once. You want to do a very slow, gradual reduction by about 5 to 10%. Week by week, because you can get oxalate dumping, which would further contribute to that pain and discomfort with the bowel movements. But that's just, and I don't know for certain that's what it is, but it's something to consider.
Wonderful. Thank you so much I'm learning lots today about oxalates. Excuse me. Our next question. Hello, I wanted to ask Dr. Copeland, how can I do a urine test to check for lead and mercury using DMSA pills? My son is 5, and I just wanted to know if he has any high levels of mercury or lead in his body. Also, how safe is chelating, and what is a better natural chelator or a prescribed one? I see. What is better, a natural one or a prescribed chelator? And thank you so much.
Okay. I would say for parents to take my answer with a grain of salt. Different medical doctors have different perspective on this, and I'll give you my perspective, and it's just one perspective. Parents don't have to agree with it. Their doctors may not agree with it. But I'm cautious with chelating, and I'm a bit skeptical about the work that's been done with chelating and autism. It is true that heavy metals like lead and mercury are neurotoxins. And it is true there is mercury neurotoxin in vaccines, like in the thimerosal, and that was not good, and it was important to get that out of the vaccines, and it's not fully been removed. And there is some correlation between some similarities, but also some differences between the neurologic problems that come from chronic or acute mercury poisoning in children and the symptoms that we see in autism. But unlike a number of doctors who are autism experts who do the chelation, I'm skeptical that heavy metals are the major cause of most autism spectrum. And even with the vaccine issue, the jury's out, but who knows the mechanism of action with the vaccines? It may be more immunological and not as related to the thimerosal, although thimerosal did need to come out. So I'm not convinced that chelation is safe and or needed in autism. And even if it were to work, I think mobilizing heavy metals in the body could maybe, when you're trying to move the heavy metals from one place to another in the body, that does additional damage. We don't know yet. I think we need to do far more research. So I'm very cautious. I do not prescribe chelation. But if you have a doctor that does and you're seeing results, there's so many different kinds of autism spectrum disorders. So that's why I say take my answers with a grain of salt. And we all need science. We need more research. I think science will guide us in this. But what if you do suspect that your child's struggling with detoxifying, and of course we're all exposed to heavy metals in the environment, especially lead, I would recommend blood tests, not a urine chelation test. So there is a blood mercury test, there is a blood lead test. Sadly, every one of us has a little bit of lead in our bodies, which is not normal, but lead's everywhere in the environment. You just want to make sure the level is below 5 when the blood test is done. Above 5 means you got to do environmental changes and repeat the test. And then if there was a really high level, chelation has been done for acute lead poisoning in children, but it's usually done in the hospital under very controlled circumstances if there's acute, severe lead poisoning, which I've not yet seen a case of in autism. So maybe I'll stop there, and there's more that can be said, but I'll get your response, Shannon.
No, I really respect you saying that and asking for caution. I will tell you that I am in the same camp. When Jem was diagnosed, I was interested in knowing what was going on with him, and we did a lot of tests that were blood tests to be able to see things. But I certainly have heard things about chelation, but it was never something that I was interested in discussing, just because I know that it's a very serious medical thing,
right,
and that there have been situations where kids have. I'm not a doctor, but I believe in the whole thing of let's not do any more harm. And
yes, do no harm.
Yes.
And that's the oath that we as physicians have to practice under. There have been some deaths in children with autism related to intravenous chelation.
Yeah.
One was from an anaphylactic allergic reaction to the chelating substance, and there was another death related to electrolyte abnormalities that then led to heart rhythm problems. A heart arrhythmia developed, and that proved to be fatal. So certainly the intravenous chelation is a concern, and I don't see real strong evidence of dramatic results on the core autism symptoms from chelation from the literature that I've read. But I will be attending a MAPS conference in March in Costa Mesa, and I'll be learning more about what other doctors who are autism experts are doing.
And of course, every case is different, but I appreciate your overwhelming message of caution and further educating yourself, because it's a serious thing. This is a very serious thing.